patient gets afterward that makes a difference.
So the patient makes really a lifelong commitment,
Yeah.
and your center is there to help support them through that.
Exactly, and we always tell the patient it's more of a long-term relationship. We don't perform the operation and walk away or turn our back to our patients. We're always there available for the patients. And we always tell the patient we'd like to see you 5, 6, 7, sometimes 10 and 15 years after your surgery, and to make sure that you're on track. And if you're not on track, it's our job to put you back on track to make sure that the weight you've lost stays off.
Long-term relationship can have its benefits, especially when it comes to this. That is fantastic. Now, Sherry in Bethlehem has a question for our panel.
Sherry has an underactive thyroid. She's wondering at what age is that typically detected, and how does it affect weight gain, and how can it be treated?
An underactive thyroid.
Okay. Well, one of the reasons once you evaluate patients for weight gain or inability to lose weight, there are certain common conditions that we always want to rule out, and an underactive thyroid is one of them. There are other conditions that you would want to rule out depending on the clinical scenario, but at least an underactive thyroid, which is very common, especially in women, especially if you have anybody in the family who has thyroid condition as well. Thyroid hormones control your metabolism. So if your thyroid gland is not producing enough, your metabolism is slowed down, so that you gain weight or you're unable to lose weight. So that's something which is very easily checked by a blood test, and it should definitely be treated. And in some people, that could be a reason why they're not able to lose weight, or they're gaining weight. So that is checked by a blood test and then treated very simply with medications. But that is something that should definitely be checked.
A lot of people say there's nothing more complex than the human body. It is a machine that needs to be tended to, and getting it operating efficiently and effectively is sometimes difficult to do. We'll learn more about weight loss in just a minute. Talk with your doctor. We'll continue. The St. Luke's Center for Neuroscience will sponsor a free program, MS First Tuesday, making the most of your doctor visits, on Tuesday, February 1st, in the Priscilla Payne Hurd Education Center at St. Luke's Hospital Bethlehem campus. Chris Levine, program coordinator for the St. Luke's MS Center, will discuss preparing for your doctor visits, establishing an effective doctor-patient relationship, and effective communication with your healthcare team. The program will begin with a patient and family meet and greet at 6:15 p.m., followed by the talk at 7 p.m. To register, call St. Luke's InfoLink toll-free at 1-866-ST. Luke's. Back on Talk with Your Doctor, discussing weight loss. How much of a sacrifice do you need to make in order to lose that unwanted weight? We're continuing our discussion, and we will continue it now with a question from Steve in Bethlehem.
Steve is wondering, how much time do you lose at work when going through these weight loss procedures?
Good question. How much time lost at work generally?
That's an excellent question. It comes a lot in our informational seminars. These are laparoscopic surgeries, and everybody heals differently, but for most part, our patients go home the next day. Some of the band patients actually go home the same day of the operation. It's just like done in an outpatient setting. So on average, our patients take anywhere from 1 to 3 weeks to recover. That doesn't mean that they're not going to be able to do absolutely anything. We actually had some patients, very large patients. We had a patient that was over 500 pounds that had an operation on a Monday. He was walking around that night. We evaluated him on the next day. He went home, and the next day, on Wednesday, he was in an informational seminar in a support group. So varies. We have some people that actually recover in about a week. Other ones take 3 weeks. You can take up to 4 weeks, and all the variations in between. So it depends on how pain is perceived, how well they're going to be healing. But for the most part, patients do very well, and it's a very short period of time they're going to be out of work.
And with the minimally invasive techniques, the recovery time is shortened a lot.
Absolutely. This is completely different from the open operations of the era. And since you touched a little bit about that, I have to tell you as well that among those 3 laparoscopic operations, we are currently offering also the single incision surgery. It's something very unique. which means that this weight loss surgery can be done through a single hole. And, only not only the cosmetic advantage there, but there's some people that actually say that they have less pain as well.
Less pain, yep.
Sure, it's one of the more thrilling parts of your job is to hear and see all those success stories. Let's now take a question from Al in Emmaus.
Al's wondering if a person can get gastric bypass surgery if he has acid reflux.
Okay.
That's a good question.
Well,
Comes all the time as well.
Is it?
we know that a gastric bypass is the best acid reducing operation. Everybody have heard about the Nissen, which is done usually for people with reflux who do not respond to medical management. People that actually fail in Nissen, which is an anti-reflux operation, usually go for a bypass. Obviously, the bypass is done a little bit differently, but I always tell the patients that whether they have hernias or acid reflux, those conditions usually get much better after a gastric bypass compared to other procedures. So a bypass or having reflux is not a contraindication to have a gastric bypass. Again, up to 90% of the patients do better in terms of heartburn and reflux after a gastric bypass.
Does it work with the sleeve too, with the sleeve gastrectomy?
Well, it's a very good question. With the sleeve, things are a little bit different. With people who are obese have heartburn because of being overweight. A sleeve in itself does not actually prevent heartburn like a gastric bypass. With a gastric bypass, you're bypassing the entire stomach. With a sleeve, it's a little bit different. They do get better when they lose the weight, obviously, but they don't get better within a few days like in a gastric bypass.
All right, let's try to take another question. I believe we have one from Pat in Fleetwood.
Pat's wondering, how often does insurance cover bariatric surgery, and what are some alternatives?
Insurance, good one.
That depends, and it varies a lot. It depends on what kind of insurance that the patient have. As part of our informational seminar, you're going to get to meet one of our insurance specialists in our hospital, and they will take our patients all along the way, explain them, what is covered, what is not covered, what kind of benefits do they have. Having a certain kind of insurance does not necessarily mean that they're going to have the procedure covered, but we're there to help them.
With your wisdom and your advice that all three of you offered tonight, certainly raised our viewers' good health IQ and got some good information. Now it's just a matter of what they can do to lose that weight. We have a very timely topic for you coming up next week. Much in the news of late, people are complaining more and more about those dreaded bed bugs. You might find them in your mattress, in your furniture, and that's if you can find them. Where do these pests come from? How are they transmitted? How do they impact our health? We'll address all that on our next show. But that is our show for tonight. We thank you for watching and hope you'll come back next Monday. In the meantime, have a good night and a great week.
Good night.
Is your window for more information about tonight's topic or any other medical issue. For physician information and referrals, or to learn more about St. Luke's Healthcare Services, call St. Luke's InfoLink toll-free at 1-866-ST. Luke's or visit www.slhn.org.